Hey everyone, this is Dr. Charlie Johnson, physical therapist and creator of a program that we call the Glute Relief Accelerator Program. Basically, it is a program where we essentially teach people how to, fix themselves, especially people who have like unresolved back, butt, and sciatica problems. That's sort of my specialty. And the goal is to teach people a process. So basically, in today's video, I have a young man named Tom. This is Tom from Canada, right? And he enrolled in our program, I think like a year and a half-ish ago. So it's been a long time coming, but basically Tom, I'll let him tell his story, but was able to use sort of the foundation of the principles, sort of underpinning a system, if you will, a pain relief system or process to not only heal himself, but then you can see he's looking pretty strong here. So I think you've actually gone on and set some PRs, right? Like in deadlifting and things like that for yourself, some personal records, if you don't know what that is. And I think you said now, did you pull like 500 pounds for like 6 reps of a deadlift?
Yeah.
Yeah, that is cool, dude. So I've never
stuff.
done that.
Huh?
I've never done that.
Yeah.
Good stuff, dude. So yeah, man, look, and one thing I want to emphasize too for anybody watching is that like Tom rehabbed himself. So, like I'll take some credit of laying the foundation, but this is really important. So you can either go to someone and have them, move you, right? Or you can learn to move yourself. And as somebody who's like cracked lots of necks and backs, I just found that you, the person in pain, you're in a position of power, relative power. You just don't know it yet. You have the pain experience. And so you know better than anybody else what you're feeling. It's just that you don't have a process to kind of pull out the solution. And so that is the goal of sort of what we do. I didn't fix him, folks. I just gave him a framework and sort of the underlying principles and process so that he could resolve his own problem. So that being said, enough talking. Tom, like, if you can, man, just begin by sharing maybe what like made you reach out to me originally. If we can go back in time, maybe like 2 years ago or whenever this whole mess started for you, sort of what it started with, what your pain experience was at that point, and yeah, we'll go from there. Okay.
Awesome. So about 2 years ago, I had a series of injuries in the gym that were sort of accumulating. And I, one day leaving the gym, was left at a point where I was having serious sciatica. You can describe it as piriformis syndrome or iliopsoas syndrome. Like there's an infinite amount of labels you can use to describe the injuries I had or the issues I had. And I was pretty strong at the time, but these injuries, I was left in a lot of pain and I was really tight and things were getting worse and worse. And eventually, I got to a point of leaving the gym one day and was in a serious amount of pain, and it sort of devolved into a state where I was having trouble walking. I would drag my left leg as I walked. I couldn't plant on it. And I couldn't sit either. This was ruthless. I just couldn't sit. I was in pain sitting. So I would either be standing or laying down all day.
Yep.
Standing while you're eating breakfast. Like it's just miserable.
Yeah.
And one thing I had picked up rather quickly was that it wasn't getting better on its own. Yep. There are those situations where they do not just heal themselves. You absolutely have to take some sort of proactive action and rehabilitate the injuries, or they will only get worse.
Yep.
And I had seen physiotherapist, massage therapist, chiropractor, kinesiologist, my regular doctor. None of them provided me with anything very useful. Some of them, I think, in fact, provided advice that would have steered me in the wrong direction.
Yeah.
And I reached out to Charlie, yourself, out of desperation, really. I'd been looking through YouTube and I found your videos. You're in Pennsylvania. We're very far away from each other, but I read through your program. It seemed interesting. And I was open-minded. I knew I just needed something. I needed help. I really did.
Yeah.
I was let off work because I couldn't work because I was just in pain and was just in a bad spot in my life as well. So reached out to you, and you got me started on the program. Now, you had some exercises to begin with that you had me working on, and they didn't really work at the beginning. But the most important thing that you showed me was your method. And that was that, you find whatever's bothering you, a yucky motion as you described it,
Yep.
and then you pick something else. You pick a motion that you want to try, and something that feels good, you do it and see if it makes you feel better in that other motion. All it is just picking something that sucks and using that as a test, and then picking other movements that feel good and using them, seeing if they make that other motion that feels bad feel any better. It's just testing and experimenting with exercise. It's a really, really simple process, but what was really important for me was I had been training for many years and had back injuries before that I had rehabilitated myself successfully. But the problem is I was going by, as far as back injuries go, I knew all of Brian McKenzie's work. I followed Stuart McGill. I had his book. I read it 3 times. It wasn't helping. I got into, what are they called? PRI, Postural Restoration Institute. I'm not sure if you know them.
I know that.
Yeah, I got into all of it.
Were you blowing balloons?
I tried the balloon because I was in that state. I was so desperate. I was like, I will do anything. And there's so many models out there, and you'll find one and you'll cling to it for a little while until it stops working for you. And that, for example, for McGill's work, which I'd followed for a while, it took me a long time to let go of that, because I was like, I was doing bird dogs like no tomorrow, and the side planks and everything, and I was getting worse. They were painful, and it took me a long time to say, you know what, man, I know this is what's supposed to be good for rehabilitating your back or your hip. It's not working. Give it up. That took so long, and I had to apply that same way of thinking for every idea I had about training, like ideas I had about how the hip should be, whether or not it's better to be internally rotated or externally rotated during these exercises, or how I thought the spine should be at rest or good posture. I had to remove all the ideas and just be as pragmatic as possible. Thinking, what is reducing my pain? What is making me move more? That's it. If it's not helping, give it up. And started applying that process, started getting rid of these like dogmatic beliefs I had about training and sports rehab. And took a long time. You told me it would take 1 to 2 years, and you were so right. I didn't want to believe it. I thought, there's no way I'll be better in a couple months back in the and it took 1.5 years till I was like back to a good point, a strong point, and now I'm back to like basically better than I was before my injury. Like I'm near the best I've ever been. I was previous to that, I had deadlifted 500 for 4 or 5 reps, and then I just messaged you the other day. I deadlifted 500 for 6, so I broke my all-time PR. But I did it pain-free this time. I was totally pain-free, no discomfort, and felt great. And with a lot of room to grow.
Yeah. Are you sitting now too?
I'm sitting right now. I'm able to sit, which is awesome.
Cool. All right. So just a couple things, man. I like to highlight this for anybody watching, right? So, a lot of people think they have like this special thing, right? Like, because they see these special things. They see the McKenzie method, the McGill method. So they say like, hey, Dr. Charlie, like, what is different about yours, right? Like, how are you going to help me? Because I tried all these other methods. Like, what would you say to that person? Because you probably might put it better, maybe.
I would say, screw the methods, man. Honestly, the methods don't matter. Like, the only thing that matters is whether or not it works. You have to be open-minded to try something. And what you teach is that belief. And I don't remember what it was, but we were talking about the McGill method, and I was trying it. And you really put it really simple and really kind of casually. You're like, yeah, if it just doesn't work, let's try something else. You said something to that effect, and I was just like, it took me so long to get that through my thick skull. But it was extremely important to get over that. And what I say to those people is, get over those beliefs, man. Like, if you already know those methods, if you've already tried them, what are you reaching out for? I'm guessing you're still in pain. Let's try something else, man. You have to be open-minded. You really do.
Yeah. So a takeaway I would say is, number one, like, beliefs box you in. Maybe that's one way to say it, right? This is a big thing. Like a lot of people think that the mindset, or just even kind of like the approach, right? That they're taking, the perspective, if you will, like has nothing to do. Just tell me the exercise. I'm like, I'm telling you, I have had people come into the program that are like, McKenzie Method worked for their neck or for their mom or something like that. So like, I believe in that. And I'm like, that's great. I'm like, but guess what? So what do? They don't want to go through a system of testing things. They want to jump right to the press ups or right to this exercise because it fits that model.
Yeah.
Right. And so people will jump, they'll try to shortcut the program. Okay. And they'll try to jump right to what they think. So the beliefs will form the actions. And then when it's not working, they'll get on call with me and they say, this doesn't work. I say, you know what doesn't work? Your belief isn't working. And because of that, we should have switched. If something ain't working, we've got to switch. If same, better, worse. Right. And you didn't want to acknowledge that same. You didn't want to look at the data. You wanted to listen to your belief. And so you are still, after 6 weeks, only committing to doing this one thing because it still fits within your perspective. Right. And so if you're not able to kind of break outside the box, it could could box you in. So that's maybe one thing. And yeah, you absolutely have to be willing to test new things. And so I have no belief about anything, honestly. Like I don't think anymore. I know it sounds weird.
Yeah, no, I know exactly what you're talking about.
I just look at the data as a scientist, and I'm just unemotionally removed because you guys are in the field running around banging skulls. And I'm like, yep, there they go.
Yeah.
And I'm just looking at the data scientifically. So, that being said, yes, you've got to be willing to break some beliefs. There is nothing special here happening. All rehab is motion. McGill is moving you certain ways. McKenzie is moving you other ways. That's it. There's nothing special about that other than they've stuck a label on it. It doesn't mean that it can't work. But was it that the McGill method worked or just those motions worked? It's just motion, people. And it's just strategy. And so that's it.
Yeah. And not just that. I think the method that you go about rehabilitating yourself can be simple, but what's going on when you're doing exercises is so much more complicated than you think. Because this is something really common in this world, and that is making a physical diagnosis, like pertaining it to a single muscle. Like it's the piriformis, that's the problem. And then you do an exercise that addresses the piriformis, and maybe it gets better or worse, or let's say it gets better, and you go, you see it was the piriformis. It's like, maybe, but when you're doing clamshells, for example, there's a lot more than just the piriformis being activated. There's the glute. There's anything else that's responsible for externally rotating the hip. There's the fact that you're laying on your side. Maybe you're in a side plank position. Like there's so many variables at play. It doesn't matter. And you don't know you can't control for all of them. And I'm just like you at this point where I don't have any beliefs about training anymore. And coming from a place where I'd read everything, I'd done all the research, but like now I'm like, I don't know, maybe if it works, if it helps you, that's great. If it doesn't.
Totally, dude. And so, and you were a little bit stuck in that diagnostics a little bit in the beginning, I think, right? You were like, well, what could it be this? Could it be that? And you broke it eventually. It took you some time.
Yeah.
Okay. But the idea is, people think that movement is inherently like this specific thing that you can do for this specific label.
Yeah.
If you have a surgery, right? Or if you want surgery, you want shots, absolutely. Like you can go and you can just cut that little thing out, right?
Yeah.
But if you're going to move and do an exercise for a disc problem, or we don't even know what it was probably. Well, we think we know, but whatever.
I still don't know. I don't know what it was. And it ultimately doesn't matter.
Yeah.
It doesn't matter what the issue was.
We move in patterns, and it's impossible to isolate one specific structure over another with movement patterns. And so when you see, McKenzie is for disc problems. No, it's not. It's just a way of moving your back this way, that way, and this way, and trying to find what works. Yeah. That's it. Okay. So diagnostics can keep you stuck. That's very good. And so here's the other thing. You said something really powerful, because not many people who are not where I'm at and have not gone through, because here's the thing. I had to, in order to break that belief, I had to go through all the different things on my end. I studied with the McGill Master. I studied with the McKenzie Diplomat. I studied all these things, knowing that I never wanted to be dogmatic, but with the intent of finding the loopholes in each of them, because I knew that nothing was perfect. And here's how I knew. When I was at USC, I worked with some of the the gurus, the people who write the books, is like the big names, okay? And they write the clinical guidelines and everything for how you're supposed to treat these things. Well, I ran a sneaky little test, okay? Hopefully USC never finds out about this, okay? So it's dug somewhere on YouTube here. But either way, what happened is I saw a person, call them, I don't know, okay, we'll call him Tom, okay? I saw Tom with this back button leg thing, let's just see, right? And mentor A, we had clinical, like live mentoring sessions where you'd come in and you'd be able to get feedback from these gurus, right? And there's a lot of them out there. And so mentor A said, do this, right? Or like, here's what I would do. And so I started doing that. And I was like, well, it's maybe working a little bit, but maybe not so much. And then I was like, well, instead of doing what I should do, which is switch patients and get different input, whatever, I kept the same person who I was struggling with. And I asked mentor B to come in the next week. And they said, why are you doing that? And I was like, this is getting interesting. Okay. And then mentor C, why are you doing that? Because mentor A told me to do that, and mentor B told me to do that because mentor C, and 7 different mentors, 7 different recommendations. And so I said, nobody knows really what they're doing here, clearly, right? And so there's no agreed upon thing here, right? And so you have to be willing to follow like scientific method, break beliefs, and then follow some scientific method. Very interesting that people like myself get these scientific degrees based in research, right? And then we do nothing scientific when we treat people.
Yeah.
We just give people, here's a sheet of things to do. This is the way we treat this problem. You would never do that if you were a true scientist, right?
Context is everything. This is so important that I learned. And the reason why these models aren't perfect is because they don't take you into context. Because they generalize over large groups of people over a long period of time. That's great, but it doesn't take your unique situation into context. And there are so many things that could be going on with you. And if you think about your nervous system and how complicated it is, I mean, technically, everything you've ever done is embedded in your nervous system in at least a very minute way. And if you do things repeatedly over and over again, that's embedded in a larger way. And if you do things very intensely, repeatedly over and over again, it's embedded in an even larger way. And, everyone has a unique life, unique training history or background in movement or athletics or their daily habits. And, what shoes you wear, if you sit on your wallet or whatever, all these little things that could add up in a small way. But you need to take yourself into context. And that's why this method is important, because it's totally based around you. It's like my model is the Tom model. It's centered around me. I know now what exercises put me into a position that I like, that feel better, and which ones don't. And it's whatever, the Tom theory, but it's just centered around me. It's just the context is me. I can't, unfortunately, sell it to anyone, but it's because it's just for me. And everyone needs to have their own thing. And it takes a lot of work, but it's totally worth it, because now you know yourself, you know how to fix your problems, you know how to improve. It's way better than just following some cookie cutter program.
And so what I tell people, man, is like what I'm selling, if you will, or how I serve people is I teach people the principles. I give people the seeds, right? Yeah. Now you might end up looking different. You might have a unique thing, but at the end of the day, there are universal concepts that tie together what all these people are trying to do. They're just moving the body, and you can only move the body so many ways. And we have the scientific method test, right, to find what's going to work or not. And you're the only one who knows what you're feeling. So therefore, I used to crack backs and necks and do all that stuff. And I was good at fixing people temporarily, but I didn't have the tie-in. I couldn't. People think you can feel and tell what the heck's going on. It's BS.
Yeah.
You can't. All we can agree upon is that when I poke Tom here, his butt cheek hurts, or he jumps off the table. I can't tell what's happening to pelvis. I can't tell this stuff. There's lots of research that has pretty much validated how poor that reliability is between people, right? And so at the end of the day, when people ask me about the program, it's like, I wish I could scream from the rooftops. Like, it is all we have, people. There is nothing else that exists beyond it. And so if this thing does not work, then I don't know what will work.
I think one other thing that you do provide is just like ideas, because a lot of people don't really know where to start. They have their pain, and they're like, I need motions to work on. And there's a lot of ways to move. There's a fixed amount of ways to move, but there's a lot, and there's a lot
Right.
of ways you can change them and create variation. And yeah, and like you gave me some ideas to start with, and I think people do need some ideas to start with because there's tons of ways to move, and there's lots of ways that they might never think of.
Yep. Yeah.
Um, and creativity is absolutely involved in this process.
And so that's the other thing, is that a lot of people think then, right? So some people might take the conversation and say like, so you're just blindly shooting in the dark, trying random things and hoping. And it's like, well, you could, right? But there's a process within that. There's a framework. So you're not just like randomly guessing and being like, well, I'll do this for a month, right? Like that's not really it, right?
Yeah.
And maybe we can talk about that. But the goal for when I work with people is say, look, here's all these options, man. There's 118 really clean options. Okay. But then you could add these combos. And so people are like, oh my gosh, right? You don't have to go through all of them per se. You might have to go through a bunch of them, right? You might get lucky on the first one. Lots of people within the first 5 tests will find something. Now you were different. That's okay. Right. But at the end of the day, like, you have to ideally, this is where, again, I try to help people is I say, look, I've got this experience. And here's the thing, the experience, because I'm imperfect, is going to be flawed. We can move the body these ways. And so here are the options. And based off of your story, where you hurt, and kind of, movement, pain, relationship, things you do that feel good, don't feel good, etc. Here's where I think we should begin. I think this is what you're talking about. Like, here's where we started, right? But then you find, okay, tested that scientifically. Now I feel confident that thing doesn't work. Right? Not, I tried everything, Charlie, and therefore nothing can work in the future because I already tried everything. No, because you tried everything, you never tried any one thing. So guess what? That means you got to start over, dude.
Yeah. And the one thing I forgot, I just mentioned, I left out of my story is part of what contributes to me being really indoctrinated and also contributes like kind of the education that I had is my dad's a physiotherapist. So
cool.
I was introduced to all this material very early on and like indoctrinated it very quickly as soon as I had my first injury. And I also was treated by him like all throughout the series, my course of injuries and my course rehab, and like unsuccessfully, like it didn't work. The theories he provided me didn't work, and the treatment itself, the physical therapy, the massage and whatnot, was temporary relief at best, if not making it worse.
Neat, dude. So let me ask you this, man. What did that end up looking like for you? So here's the crazy thing is some people come to me and they're like, dude, you're the doctor, so just tell me what to do. And I'm like, that's your first problem.
Yeah.
I know people don't like that, man. They're like, screw this. I thought you were going to help me. 2 things I want to highlight is that, yes, you might not be the doctor, but I can't feel what you're feeling, man. How do you take that now?
Man, that's a good question. I was thinking, they say you're a doctor, but I think in the kind of how you do things, you're a lot like a consultant in a sense. Yeah. Like you're providing, you teach them a framework and then you're providing suggestions and guidance. But I don't know, you have to get over the fact that someone's not going to fix you. I was pretty early on of the idea that I could fix myself, and that's a really, really important belief to have. Actually, that's probably the first and foremost belief you should have, is that you're capable of fixing yourself. Otherwise, you will not stick to the process, and you will fail. I mean, you won't get any better.
The one thing I want to highlight, man, is I would say that you stuck in my brain is probably one of the most like 2 things. One of the more challenging cases for sure, but you use the same framework, whether it's complex or it's not, you use the same framework. And so what I want to highlight for anybody watching is that, dude, I have people reach out to me and they say, I've had this problem for X amount of time, right? And what if I find in the first 2 weeks that it's not working? Oh, well, the level of persistence, man, and ability for you to show up is like second to none. I'm not sure, right, that I've met anybody who has gone to the length that you have to really solve this. And so what I would highlight for anybody watching, right, is, if you're going through something, right, and they're doing the same thing over and over again, then yeah, you should skip out of that if there's no change. But as long as you're committed to a process of testing and curiosity, then it might happen very quickly. Or what happens is they say, this doesn't work. Well, this is a dynamic process. So there's nothing to this. Okay. This is just a process. And it could be that you go 8 weeks and then in 1 week you find a motion, if we need motion to solve it, and boom, well, you bang your head against the wall for a while. But when you look at it objectively, it was just, this isn't working. This did not work. But we're emotional beings. So what happens is when you get to 2 weeks, 3 weeks, when these people are calling me saying, what happens if this happens, right? Well, nothing happens. You know what happens? Yeah, we do the next thing.
Yeah.
And so last little thing, most people will not be able to get over the frustration of and then they bounce because they say this doesn't work. Well, this is all you have, man. And it is scientific method. And so we started here and we tested this. It could be you just didn't find it, but will you hang in there long enough? How many times are you willing to fall off the bike before you just scream? Are you going to fall off twice and then say, I'm incapable of learning how to ride bike? Come on, right?
Yeah. For myself, I felt like I just had no other choice. Though I'm like, because I was lifting and just kind of bodybuilding recreationally for myself, and I love it. It's my sport of choice, and it's fun, and it improves my physical health and mental health. And I'd fallen off for a while and lost a ton of weight and strength, and it's like I wasn't me anymore, and I felt like I had no other choice but to get back. And I always believed, really, really important, I always believed that I would get better one day. I didn't know how soon it was going to come. I didn't know what it was going to look like, but every day was an opportunity to try something, to feel better.
That's important, dude. That's important. So like replace expectation with curiosity and just going through the process.
Yeah. And you'll learn a lot. You'll learn a lot about yourself. And if you do the process honestly and make it through, when, eventually it's extremely rewarding, because you're now capable of fixing yourself. And anytime you have any other injury, you apply the same process and it doesn't wear on you as much. You're like, I know what I'm doing. I can handle this. It'll take a little bit of time, but I can measure it and ensure that I'm going in the right direction.
Measure is important. And that's another thing, dude. So most people come in and they use this framework. I had a woman the other day who said she goes to PT. I say, well, what does that look like? Or the chiro, and they say, well, they sit me down. They say, hey, you're doing better today, right?
Yeah.
Well, that's a lead-in question. So no, we don't ask that. All right. How are you doing? Right. And while I think it's maybe a fair question, it's just kind of like habitual for a lot of people. Like you go to a party and you're like, hey man, how are you? Right.
Yeah.
There's no room for that really in science.
Yeah.
Right. And so talk to me about like that measuring process, man. It seems like it was valuable.
Yeah. Really, really important that you have a notebook or some way of measuring and tracking your progress. Progress is not going to happen in a straight line. This is something I also learned during this process. Super important. Does not happen in a straight line. There's going to be ups and downs within the general curve.
You can't manage what you don't measure. It's maybe one way to put it, right? And measuring pain is messy and or imperfect.
Yeah.
And so I try to have people measure two things, two kind of realms, if you will. Movements that are, so movement quality, things that don't feel good, right? And there's many of them, okay? And also function. And oftentimes they might overlap, right? So for example, bending forward is a motion, but it's also function, right? But maybe it's tying shoes or something,
Right.
But, and so having maybe a couple things there to be able to track. So this way, you don't track everything, but you've got to have something to ground yourself. Otherwise, you're just like, how are you feeling? And it could be because it's sunny out today that you feel good. And so you've got to have something objective. It goes back to like science. So yeah, cool.
Solution might not be what you think it would be, or might not be what you want it to be even. And it might arrive in the way that you think it will. At the beginning, you might hope that you're going to try this exercise and it'll instantly, miraculously fix you. And it may not be that way. It may take a number of weeks, and it may be very effective, or it may be instant. It may be that as well. Again, context is everything. It depends on you. Another small piece of advice I think is really important is I actually, during the course of this process, built a home gym so that I call it the lab, because
nice.
I literally used it just for experimenting over and over. And it was really important to have it in my home, because I could multiple times a day perform tests.
Versus going to someone else and paying them to go to their office or whatever.
Yeah, like 3 times a week. That's a really low frequency, and it take a long time to rehabilitate, to find what's good. If that's how frequent you're attempting to address the problem. If you can once a day do a test or do a treatment and test it, You're going to be way better off. Multiple times a day is even better. And even like having some small exercise equipment at home, some bands or some weights, depending on your level of experience.
That's cool, dude. So one thing I tell people is like, you got pill shot surgery, or you can go to someone and they can move you, or you can learn to move yourself. And I used to move a lot of people with lots of osteopathic, like hands-on training in my past. And I don't do any of it anymore. Right. And why? Because I was like 3 times, what is there, an average of 4.3 weeks in a month or something like that. Right. So 3 times 4.3, I can't do the math, but let's just say it's like 14 or 13 or something like that. Right. So there's 13 tests I can run for this person, right, within like the month. All right. If I could teach them how to move themselves and give them a process and what the options are and how they can go about solving it, then they can do that over and over and multiple times even throughout the day. Like it's just math. People think it's like I don't know. I'm like, I am biased, I guess, but I'm just looking at math. Yeah. It's like the ability for you to solve your problem will infinitely be more if you can move your own body versus if you got to drive to the mechanic every time.
Yeah.
And so you can solve your problem potentially faster if you can learn to move yourself versus just like paying copay 3 times a week for somebody else to not only not give you the knowledge, just tell you what their beliefs are and impose them upon you, but then they can only run so many things while they're there. Good stuff, dude. So here's what I want to do, man. Like maybe like 2 final things as far as just wrap up questions. Like, do you have any words of wisdom, man, for anybody who's stuck in pain? You kind of maybe just gave it, but stuck in pain, like where you were at, they're feeling frustrated. They've tried a couple things and they're just like, I don't know what to do.
I honestly think a lot of the issue is our own heads we're getting in our own way about it. Get out of your way.
Yep. Cool.
Give up the beliefs you have about what's supposed to work and what doesn't, and try everything and keep trying and keep track.
Neat. Awesome, dude. And then what would be your response to someone who's like, hey, will this program work for me? Will this process work for me? Like, what would be your final words there? Mm-hmm.
It's the only thing.
By the way, it's not my process. It's just, it is science.
Yeah. I mean, it's ultimately it's the only thing that'll work. Yeah. Because like, as you said, there's no other, like, it's just the scientific method, really.
Yeah. Cool.
Yeah. I mean, it'll work if you stick to it. It does require persistence and discipline, but you'll come out of it with like a real solution.
That's awesome, man. So what I want to do is I just want to wrap up with this, some take homes. Okay. So I wrote down some notes here, right? So I would say take home number 1, like power is in the process. If you don't have a process and you're not testing, you're just guessing, right? So instead of focusing on pain relief, this is why I tell people, because it's up, down, right? Like that just takes you on this mental, physical, emotional roller coaster.
Yes.
Focus on learning a pain relief process and then just let pain relief follow. As long as you follow that process and you don't let yourself get in the way, right? Like most people can do it. Okay. The process, by the way, is the scientific method. If you don't know what the scientific method is, you can easily look it up. Now, where I help people is, well, I teach them that applied to healing. Okay. But then there's so many options. So we help people kind of understand pain patterns and where to begin. And also then outside of that, it's like, you want to take what you learn and what you understand about what makes you feel better, what makes you feel worse. You want to apply that to life too, so you can optimize things. You're not constantly ticking it off. Now, this is like kind of a McGill nugget, right? He talks about, hey, like stop picking the scab or whatever, puts it in a different context. But basically, that's what he's talking about. We call this optimize the environment. He talks about it physically, but you also, and this is very commonly missed, you also need to optimize this. This is going to be the one thing. I know you could do it. If you were a robot and this thing was like very do, but the emotions, the frustration, like, oh, I think this will work. Or like that motion, I don't know if it'll work. Well, why do you think that won't work? Because my grandma tried it. That's another belief, man. And so they're gonna come up. So you're normal. It's part of being a human, dude. They're gonna fly through it every single moment. But you have to recognize, like, what is the signal and what is the noise, right? So we talk about trying to separate those two. Beliefs block you in. We kind of just talked about that. Focus on what you can do was a very big thing. There was a mentor of mine who used to be a teacher. And he said, Charlie, think about it like this. Because I said, we were talking about how, like, when people are in pain, they just want to focus on like the area of pain, right? And that's the only option you can use to solve this thing. And I said, well, he said, when you grow up, and you take a test, he said, what do they circle? They circle everything you got wrong, and it's in red, right? And so that's what you look at. They don't circle all the things in green that you got right and forget about the red things. And so we are very much used to being like, I can't do that. I can't do that. It's right here. Problem focus, right? And we get this myopic view versus being like, well, the whole body's connected. And even if you can't do that one thing, why don't you just flip it, invert the question, inverse thinking, and say, well, what can you do? So maybe you can't do that in the gym, but the opposite of not being able to do that on that side is maybe you can do it on this side. And the opposite of not being able to do it on the lower body is on the upper body. And so you can get creative and stay as active as possible. Don't treat the diagnosis. It's useful, right? Initially, maybe to have some realm of understanding to make sure it's not something big, ugly, scary, and or you actually need this or that or whatever. But then within that, movement is non-specific, and you can use movement as medicine. Just like you said, you can find something that works, dude, and then you can bottle it up, but you only know if you've been tracking things, right? And then you can optimize the dose, like you said, the frequency, the time. And if you want to get creative like they do on Instagram, then you can do that. But you've got to have like a foundation first, right? You're capable of fixing yourself. This is probably like a really important belief. You said that. I think that's really cool. So I think of this like, I would call it like burning your boats, right? Like if you want to, if you're like, oh, I don't know if I can swim. Well, I guarantee that if there's sharks in the water, right, and you pop your raft, you're going to figure it out. And so that sounds maybe a little bit hard, right? Or upfront for a lot of people. But if you want to get better, you know, instead of being like, oh, I wonder, make it work. Make it work. And how are you going to make it work? You're only going to make it work if you have a process and you have some framework, right? Outcome independence. This was another thing. So you're just like, hey, man, don't get glued to the result of the one thing. Just look at it. And if it's not consistent with what you thought would work, sometimes it's not going to happen. That's okay. Instead, go through the process and let the data tell you what to do. Moving yourself collects data faster versus relying on someone else. And I think like final thing, dude, I wrote too many nuggets here. Keep showing up, right? I would say you, man, to just close it up, like are a super good example, probably the strongest example of somebody who has continued to apply the process because doing nothing wasn't working, right? For a while.
Oh.
And so, you know, some people argue, well, it was just time. Dude, you can't separate the two, but you had tried doing nothing. And there was a very clear set of data. It says, if Tom would just wait this thing out, we don't know what would have happened. All right. But at the end of the day, you like grab the bull by the horns, dude. And like, even though, yes, you had the natural human response of this shit didn't work, this didn't work, whatever, you continue to like plow through and just like go back to something that was grounding you. In your case, notebook. I basically have like a weekly tracker, a healing log that I give people at this point, right? But data, and that's like true persistence, dude. Like that is super cool. And I'd say more than almost anybody I've worked with, like you actually get the process. And I would feel confident, man, that you could apply this to any shoulder, neck, knee. You just recycle the process for anything, dude. You know, people say, well, what about if I have this? What about that? You're in this, it's in the same body. You know what that means? Same freaking thing.
Yeah.
But that's all I got, man. And so look, for anybody watching, I know it was a long one. So if you stuck around, then like bonus points, right? But let me know your thoughts in the comment. Really cool experience with Tom. Again, Tom from Canada is what I would always say. We're getting on the phone with Tom from Canada. But either way, we were far away. This was a totally virtual thing. In fact, dude, like I think I met with you for like a month and a half or something like that, right? And as soon as you got the process, it was like, cool. You ran with it. And you solved your own issue, dude. So super proud of you for that, man. I appreciate the update. But if anybody's watching and you're interested in like, hey, I kind of get big picture process, but as Tom said, there's a lot of nuances within there, right? And so we basically put that together inside of the program, any type of unresolved back butt or sciatica problems. Best first step would be to basically set up a time to chat to see if it's a fit to work together inside of the program. There's no charge for that. We would just sit down and I'd review actually a case to see, hey, does this make sense? How do I think I can help? What would that look like, etc. The link to do that or book a call is below this video, probably in description. That's all I got. Thanks everyone for watching. And Tom, I appreciate your time, dude.